Now, moving topics, did you know that lung cancer claims more lives than breast, colon, and prostate cancers combined? We talked to an expert to find out more about new treatment options.
Well, lung cancer is by far the leading cause of cancer death among men and women. But now amazing advances in lung cancer treatments are helping to change the outcomes and provide much needed hope for all diagnosed patients. Joining us today is Dr. Julie Bramer, oncologist and renowned lung cancer researcher at Johns Hopkins, as well as Barbara Marder, a lung cancer patient. Thank you both so much for joining me this morning.
Thank you.
Well, doctor, it is astounding to hear that lung cancer is, in fact, the highest rated form of death for cancer patients. So tell us, you have some great news for us that there might be some hope for cancer patients.
Yes, hope comes in two forms and two amazing new therapies. One is targeted therapy, which is specifically developed to target an abnormal gene in a patient's cancer. So it's very important for lung cancer patients to know that they need to ask about gene testing or mutation testing in their cancer. Based on that testing, a drug may be available to be able to target that mutation and kill the cancer cell. Unfortunately, these mutations aren't always seen in our cancer patients, or they may have mutations where drugs are not yet developed for. In that case, we also are developing immune therapy, and we hope immune therapy can work for all lung cancer patients. And what immune therapy does is that it unleashes your own immune system to attack the cancer.
So is there any kind of testing, doctor, that needs to happen for patients to maybe qualify for these new treatments?
So for targeted therapies, you have to test the tumor itself to look for abnormal genes. These are not genes that can be passed down to you from your parents, but just something that's gone wrong with the cancer itself. We are also developing tests to look at the blood, to look for cancer DNA that's floating around in your blood, to be able to pick it up that way as well. For immune therapy, it's slightly different. We don't yet have a test that easy to detect who would most benefit from this type of treatment. And that gets me to research and how important research is to advance treatments and give patients and their families new hope.
Well, actually, Barbara is a lung cancer patient as well. And Barbara, you have had some success using these treatments. Tell us a little bit about your story.
I've had a great deal of success. About 4 years ago, I was diagnosed with lung cancer. I had then a very standard treatment because the tumor appeared to be contained. It was surgically removed. It looked as though everything was clean and clear. I had some chemotherapy as a preventative measure and then went about my, I thought, renewed life. However, 18 months later, my periodic CT scan showed that the cancer had metastasized and was now in the other lung. This was not good news. At this point, I talked to Dr. Bramer to see what options there were in the way of treatment. The other chemotherapy regimes that could be tried were not really viable for me because was a kidney donor and my kidney function is weaker. These drugs put some pressure on the kidneys. However, there was an opening in a clinical trial for an immunotherapy drug, and that is what I opted to do. This has been very, very successful for me. Within weeks, the tumor was shrinking. Within 6 months, the tumors were gone. I've been in the part of this program for over 2 years now, and the tumors have been totally missing. All my CT scans are clear. So I cannot speak strongly enough for asking your support for research, for checking out the Lung Cancer Foundation of America website, seeing what you can do, what you know about lung cancer, and what's being done, how you can help with the 30 Days, 30 Ways campaign. Is the hope for my relatives, your relatives, future generations.
Well, Barbara, your story is absolutely inspiring and motivating. We hope our viewers take the time to visit that website and help out. But really quick before I let you both leave, doctor, is this treatment a cure for cancer?
Well, we hope that it could be a cure, but we're not quite there yet. Again, through research supported through different avenues, specifically the LCFA, or Lung Cancer Foundation of America, we can actually gain the funding that is greatly needed to support research to really get us to a cure.
Absolutely. And one more time before I let you leave, tell us that website again where viewers can go to help.
lcfamerica.org.
Well, I thank you both so much for taking the time to speak with us, and Barbara, for you sharing your personal story with us today.
Thank you.
Now stay where you are. The Morning Blend will be right back.